Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, everybody. It's Dr. Nancy O'Hara, and I'm thrilled to welcome Dr. David Brady. David's been in practice in integrative medicine for over 30 years, 25 years in health sciences, academia. He's a licensed naturopath in Connecticut and Vermont, board certified in functional medicine, clinical nutrition, fellow of the American College of Nutrition, chief medical officer of Diagnostic Solutions, Designs for Health, and in private practice in integrative medicine in Fairfield, Connecticut. He's a former long-term vice president of the Division of Health Sciences and director of a Human Nutrition Institute at the University of Bridgeport in Connecticut, where he continues to serve as director and professor emeritus of nutrition. David and I met years ago and really got to start working together when we were lecturing at a conference in Vermont, and have worked together in many capacities. And David, I really appreciate you being here, love working with you, and love to hear all about what you're doing.
Oh, my pleasure, Nancy. I would never not do whatever you asked me to do. I owe you a great debt in so many ways, professionally and personally, and it's always a pleasure to talk to you. So it's great. Thank you.
Well, thank you. And I would love you to just tell the story of how you got to functional medicine, because I love hearing it, and I'm sure our listeners and viewers would too.
Yeah, that could probably take the whole hour, but I'll give you the really Cliff Notes version, I guess. Well, short story, I grew up, with my mother battling breast cancer my whole youth, basically through the 70s, and, getting 1970s style chemo and radiation at Sloan Kettering in New York, and I think they were trying to do the best they could, but it was pretty darn brutal, and even as a kid watching that, it was pretty evident that that wasn't ideal, and so it did always, even back then, get me thinking there's got to be a better way to do things than this, and more humane. And actually, family friends of ours, they're very good friends of me and my brother and sister. Their dad was kind of in parallel going through a prostate cancer battle. This was in the late 70s now. And they found Lawrence Burton down in the Bahamas doing the first immunotherapy stuff by, extracting people, taking blood every day and and banking all the different subsets of lymphocytes and immune cells, and then introducing them back and trying to keep an optimal level of immune cells as a sort of a very early elementary way of doing immunotherapy. And I was fascinated by Burton because I remember going to a lecture with him. It was long before I had any training in medicine. I was quite young. And, I found out he was one of the guys at Sloan Kettering back in the early 60s that really kind of refined what at that point was the current chemotherapy model. And I remember him saying this distinctly. He said it was like shooting a shotgun straight up in the air and hoping a duck flew by,
Yep.
You just shoot anything and hope it's what you're aiming at. And he said he realized he created a monster and that wasn't the way to go. And he really was convinced the only way to do this was to get the human's body's own immune system to be able to differentiate better and fight the fight. And so that made an impression on me. But then I went off into electronics engineering, and I worked for McDonnell Douglas Aerospace, now part of Boeing. But somehow through that, I found my way into using like computer-aided design and manufacturing and all these things that we were doing in aerospace and applying it toward a medical context. We were using these computer-aided design and manufacturing systems to develop the first custom-made total joint replacements, so hips and knees and things, but they're pretty easy. But we did the first wrist, actually, because the wrist is a very complicated joint in many ways,
Yeah.
not just a ball and socket or a hinge joint. It's got a lot of subtle different motions and checks and balances on different planes of motion. And we did that at the hospital for special surgery in New York City. And at the time, it was very early in joint replacement, and it was really off the shelf sizes, which by and large it still is. We'll give you a large
Yeah.
or an extra large or a medium or whatever. They get a little bit more honed in on millimeters and things, but this was actually digitizing someone's plain films and early advanced imaging, and actually right in the hospital making their joint replacement in a semi-sterile machine shop with inert ingredients that wouldn't immunoreact. And it was just really cool. And that got me into, saying, boy, I'd love to apply my engineering background to the human experience, not rockets and planes and stuff like that.
Yeah.
And I looked at going into orthopedics, but at the time there was a glut of orthopods, and they weren't real favorable on the profession because we were coming at an HIV experience, and it was a very bloody sharp, thing. They were all kind of scared, frankly, at the time. And I
Yeah.
was working with a lot of PTs, and somehow through that, I eventually I wanted biomechanics, like applied human biomechanics training. I ended up going down to Texas to Houston and went to chiropractic college first because they had early like gait analysis and Olympic athletes, and they were working with a lot of pretty cool folks in the Houston Medical Center, and it was very progressive there as far as chiropractic training at the time. And it just happened. I ended up there, and I had a mentor there who sent me off in a different direction. He was originally a registered dietitian, was very into botanical medicine, ended up becoming a chiropractor, but he was the nutrition instructor there. And it really made an impression on me. And I was kind of getting almost like naturopathic medical school within the context of chiropractic school. And so that once I graduated, I really was more interested. I stayed on and did a whole year residency and hospital rotations in or diplomate in internal natural management of internal disorders, believe it or not.
Wow.
So it was really cool. And then I went into practice. I found functional medicine in the very early days. I think I was at the second annual conference of functional medicine. I think they're on their 30th one or something like that. So I found, this crazy, brilliant guy, Jeff Bland, many, many, many years ago, and started following him around like a puppy, and ended up on the first faculty of IFM and got very embedded in the functional medicine movement as it matured. Started working with nutraceutical companies in education as a KOL, and then formulating products, and then I got a graduate degree in nutrition. Then I ended up saying, I'm going to just go back and do the deep dive. And I went back to medical school and did the, whole modern naturopathic medical school education and residency, and just been in it for so many years. It's all a blur.
Wow. Well,
Yeah.
I find that fascinating. I've learned new things about you that I didn't even know.
But I was originally a musician. See all the guitars back there?
Yeah.
I still can't kick that habit. So
I love hearing it and seeing it on social media. So, and you've become such an expert in autoimmune disease, from those early days to now. I mean, you wrote a great book on the fibro fix and many articles on fibromyalgia, on the microbiome and autoimmune disease. And this is about PANS and PANDAS, but that's just another autoimmune disease.
yeah.
And from your perspective, do you think that inflammatory and autoimmune diseases are on the rise? What does the data say about that?
Oh yeah. I have some great charts in some of my lectures and presentations showing the epidemiological incidence curves from, early 20th century till present. And it's a meteoric rise across like that, like a steep curve across just about not every, but just about every autoimmune disorder, whether it's classically considered maybe in the old parlance Th1 dominant, Th2 dominant, atopic, not, it doesn't matter. They're all
Right.
going at a steep rise. And I usually make the point, everyone's so tuned into genetics and genomics, and they say, well, autoimmune disease is very, genetically determined and inherited. It runs in families. And all of that is true. There's definitely, inherited predilections in your immune response and HLA types and all these different things that we know about now. But it's clearly how that immune system dances with the environment, and the genes don't change very quickly. They change very
Right.
slowly, glacially almost, compared to what we're used to in how we frame things up. So a meteoric rise in the incidence of all these autoimmune and chronic inflammatory disorders, it's not a genetic thing. It's an
Right.
environmental thing, clearly, right? So it's something about our environment that we're bathing those genes in has dramatically changed, because that can change quickly. The genes don't change quickly. So it's not
Right.
that the genes aren't involved. It's just that they're not the dynamic element of it. They're the fairly static element of it. And when you look at the incidence changes, they're so rapidly going upward that it almost, to an epidemiologist, they look at it and go, oh my God, this is an infectious outbreak, right? Because nothing else changes that quick. Even the environment, although that's probably reframed in the last 50 years with how many
Yeah.
chemicals and how many things just come out at rapid fire. But you can really, and not in every case, because there's various triggers and there's various external or environmental influences and antigens and the exposure, as they call it. But by and large, a lot of autoimmune diseases, as you know, are infectious diseases, right?
Right. Right.
They're viral or they're whatever. All these post-viral syndromes that we're dealing with now. I'm just personally, in my case of my lovely wife, and just so many patients, and just the whole experience out there with long haul COVID. It's just another post-viral autoimmune chronic inflammatory driven, variant, syndrome.
Right.
So yeah.
Yeah. And, like you're saying, genetics may load the gun, but it's all the things in the environment,
Sure.
infectious, toxic, otherwise, that
Yeah.
that lead to all of this. And I also find it fascinating, not just historically, but also geographically. I mean, the difference in autoimmune disorders in developed countries
Yeah.
versus developing countries. And I think that's a fascinating look at what are the things that are really affecting these autoimmune disorders.
Yeah, and you can even parse it by latitude, right? Like,
Yeah.
D levels and things like that, incidence levels, But you're right. The biggest determinant is, where you were born and where you're growing up, basically what's your environment. And this modern autoimmune epidemic, if you want to call it that, because it is an epidemic, is really one of the industrialized developed worlds. If you go into sort of the third world, underdeveloped world, you just don't see it. You see other things,
Right. Right.
related to poor hygiene and, and lack of sewage management and all that, but you see much less autoimmune disease, maybe partly because of what I just said, because they have a much more wider exposure in youth when their immune system is learning tolerance, right? We kind of live in
Right.
almost semi-sterile environment that we've created. But what I find most fascinating about the incidence difference between like the classic industrialized Western countries and then the underdeveloped world, the stark differences in autoimmune rates, is there's a middle ground. There's a
Yep.
mid cluster, and those are the countries that kind of have a Western modern industrialist lifestyle, but they have clung a little bit more to traditional diets and ways, and they're far enough away from us that they're not fully poisoned by us. So it's funny, if you look at countries like Japan, South Africa, Australia, New Zealand, they're in a middle ground, right?
Totally agree.
They have it,
Yep.
but they don't have it like the United States or like Western Europe has it.
Yep. Yeah, no, so agree. And I think diet does play such a role, and the lack of immune tolerance is so affected by what we're eating. I mean, do you see that as one of the big reasons for the growth? Or toxins, infections? What are the biggest reasons you see for this big explosion?
I think it's a combination of a lot of things. It truly is one of these perfect storm things, right? You mentioned some of them. I think generally, if I had to pick the three biggest factors, I think one is diet, of course, the industrialized countries just eating all this crap processed food. And finally, outside of just this bubble we live in with these wellness people and functional integrative medicine savvy, tribe and the kind of patients that kind of find us in the wider general public, in the Western industrialized countries, there's finally an awakening and an awareness that diet makes a big difference, and all this stuff that they're poisoning us with, and this stuff that's in like the American version of the food that's not in even the European version or the Canadian
Ugh,
version. Like, oh,
I
these
know.
are American companies poisoning Americans intentionally. Like, what's going, So finally, there's a reckoning, and you finally saw a red dye free pulled, but now
Right.
it's a list of 60 others that should be on it. But I think poor diet, like a computer, garbage in, garbage out, right? You just have poor
Yeah.
metabolic outcomes. People are obese. Obesity lends itself to an inflammatory bias and, dysregulation of the immune system. So diet's a big one. The other is just the exposure to chemicals, plastics, herbicides, pesticides, all the junk in our environment that has just exploded in the last 100 years, but certainly even more so in the last 50 years.
Yeah.
So the exposure to just an exhaustive, never-ending level of new chemicals that the human body has never confronted before. Thank God we have a fairly non-specific, adaptable detoxification system built in, or we would long be gone, right?
Yep.
So
Yep.
bad diet, toxic exposure. But the other thing is, I think those two things combined and other factors have pretty much eradicated many of the beneficial, commensal, very important organisms in our microbiome that live in us, on us, and around us, and particularly so the ones in the gut. So the GI microbiota, if you look at the microbiota composition in the gut of people like in blue zones, let's say, like on the Greek island blue zones, or in the Bulgarian blue zone, or wherever you go in the Japanese blue zone, their GI microbiome is very different, and they've preserved more of these organisms that have been part of a normal, healthy GI microbiota composition for the whole evolution of humans on the planet. And the people living this modern Western high stress, high inflammatory kind of existence have eradicated many of them. There's much less diversity. There's much, you have a strong bias toward only a smaller number of organisms, and many of them aren't the most healthy ones.
Right, right. And I think it was you when we lectured together back in Vermont that you were the first person I heard say something like probiotics are like peeing in the ocean.
Yeah.
And it's so much more than just replacing the beneficial flora. It's the complete breakdown and the commensal relationship between fiber and the microbiome, and so much more than just, oh, well, I'll eat like crap and throw a probiotic in and I'll be fine.
Yeah, because people have a very distorted view of what probiotics are and what they are not. And I will add doctors to that list. I will even add functional medicine doctors to that list. There's a perception you can take a conventional probiotic and you're replacing the good bacteria. No, you're not. Because the really good, important bacteria in the human microbiota composition are not the ones you're taking in the probiotic. Things like Lactobacillus genus, Bifidobacteria. I'm not saying they're not useful and helpful, because they are. They do
Right.
create clinical benefit. We know that, but they are not normal parts of the human GI microbiota at any appreciable level. They're super, super low levels, and they're there because we exogenously consume them in some way.
Yeah.
Are not the core beneficial bacteria, the keystone commensal organisms. Those are anaerobic organisms. Those die in the presence of oxygen. So up until recently, it's been impossible to put them in a pill and give them to people.
Right.
You can't do it. Those organisms die. They make up 90% or more of the microbes in the human GI tract. So when we give a conventional probiotic, like Lactobacillus bifidobacteria, these were first found and understood by people like Mechnikov in a blue zone in Bulgaria, right? Like the first lactobacillus was Lactobacillus bulgaricus, named after this Bulgarian blue zone, right? Because he was in Russia, he found out, oh, in Bulgaria, there's these people that live up in the mountains, and they live like, at the time, this was, 125 years ago, they're living past 100, right? They're living to 110, and they're healthy the whole time. And what's going on? And went and studied them. And of course, they lived in a pristine environment. They had these, beautiful cows that had very good genetics that were feeding on these, organic pastures, in the mountains, and they were taking the dairy products and they were culturing them and making like kefirs and yogurts and things like that. And he was convinced that it was something in that was the magic elixir of health and youth, and that's when they first, early microbiology, they found lactobacillus and lactobacillus bulgaricus specifically, and that was
Yeah.
the first probiotic. But that's one little sliver of the microbiome, right? But they were able to, it was in these culture products because it can survive in oxygen.
Right. Right.
But they were able to put that in some kind of medicinal, like a pill, but they were
Right.
never able to do these commensals. Now we're just starting to be able to do these next gen probiotics. You see commensals out there like an Akkermansia or something, but it's still, the science is still a little bit fuzzy around the edges on that. Like an Akkermansia, for instance, we know it's a commensal. It's important to maintain the mucus layer on the gut and things like that.
Right.
It's a U-shaped curve. The too little Akkermansia is associated with obesity, metabolic syndrome, poor metabolic health, and all that. Conversely, too high Akkermansia is at least associated with, now, not necessarily causality, but association with higher incidence of autoimmunity like MS. So,
Right.
now there's a rush. Oh, let's put out these things now that we can put them in, we can lyophilize these organisms and keep them away from moisture and band them in a capsule and put them out. Okay, well, a little is good, a lot better. Let me take as much of that stuff as I can get. That may not be the thing to do. And again, I don't think one organism is the key. It's the community effect of these commensal organisms playing together. So
Exactly.
that's why fecal microbial transplantation works the best of any of it, because you're getting a community effect of a
Yep.
myriad of these important commensals and you're introducing them together as a network. It's much different. It plays out entirely different when you look at the metabolic expression of the gut, whether it's in simulations like robo-gut simulations or in actual
Yep.
human subjects. But
Yeah.
it's not easy to go get fecal microbial transplantation.
Right. 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 But it is about the whole
Yeah.
gut, the whole child, the whole picture.
Right.
Not
We
about
always try to myopically narrow
exactly.
it down, right? And that's the pharma thinking. We're guilty of that in functional and integrative medicine too. The latest supplement, the latest nutraceutical, the latest thing is the bomb, right?
Right.
And
Right.
usually there's a good element to it. There's a real story there. There's a mechanism of action. There's all that, but rarely do things produce dramatic, incredible, transformational changes in a complicated system like human physiology
Right.
in a
And it's
singular
the
thing.
same way with precision medicine or
Right.
genomics. We can't say this SNP means this supplement and then you're going to be all better. It's
No.
more of the interplay of everything.
Yes,
So,
exactly.
so what do you tell, people or parents for their children? What do you think helps defend against, these autoimmune disorders, the chronic inflammation? What are the most important things from your perspective?
Well, and you know this far better than I, but I just think you can't change the genes, right? So you can't get hung up on this runs in the vein. We can't change the genes. Maybe someday we'll be changing genes, but if you think pharmaceuticals have bad side effects, wait till they start slicing genes around, right? That could be interesting. I still remember the first day of pharmacology class, Nancy, this was before medical school. This was my pharmacology instructor in chiropractic school. I think he came in, he was a pharmacologist. And I remember we went to the lecture and he says, okay, I'm just here to tell you that pharmaceuticals and drugs do not have side effects. And everybody looks at him and kind of laughs. And he goes, they only have effects. We like to call the ones, we call the ones we find inconvenient side effects, right?
Exactly.
Not side
Or
effects, they're
then we
effects.
develop the medication for that side effect because,
Right,
yeah,
exactly.
it makes you so sleepy. So let's say it helps you with sleep.
But he made his point. But he was, because I remember he also said once, use a new drug as soon as it comes out before it develops side effects. You always hear that term, right? A drug developed side effects. No, it didn't. It always had. But back to the answer to your question. I think, parents have a hard job to do. I mean, my wife and I tried to manage this as best as we could because I was a functional medicine doctor, right? Nutritionist. and she was very health conscious, professional dancer, real into diet and health and very good, physical condition and all that. And we did the best we could with our kids, but it's hard, and we had a very picky, one of our boys was an extremely picky eater, like had these food issues, food phobias, right? And it's not as easy as, oh well, eat this or go hungry, you'll eat, try again tomorrow and see if you like what he would just not eat. I mean, I think he'd
Right.
start before he'd eat something that he had a thing with, right? So we did the best we could and managed it, and now he's much, much, much better as far as his eating and things. But I know how hard it is. But I think you really need to, first of all, those early exposures and early experiences are just so important. So if unless there's a reason, a good medical reason why it can't be the case, natural childbirth is just so preferred to a
Yeah.
C-section. And then even seeding of the right bacteria into the infant, particularly if they have C-section.
Right. The
And
good old perineal picnic.
yeah, exactly. And then breastfeeding is so important if you can, and if you can't, pumping, and then if not, the optimal best types of formulas, make sure you test for sensitivities before you just start jamming some kind of a formula if it has to be used into the child, and pay attention to how they react to it, as dermatitis, skin disorders, all these things, and these manifestations in kids and colic are not necessarily just things to, oh, they'll get over it, it's fine, it happens to everybody, no, it's the body telling you something.
Right.
You know what I mean?
Right.
It's sort of like the concept of, oh, the minute any kid gets a fever, well, give them Tylenol and suppress that thing. Well, the body's doing a fever for a reason, right? The immune system's probably sitting there when mom's reaching for Tylenol going like, what do I got to do here to get the message across?
Exactly. Not to mention the decrease in glutathione with the
Right.
acetaminophen, and absolutely.
And I know there's a time that you have to manage a fever. I get that.
Right.
But there's a time when you got to let it roll too, right? So, and there's
Right.
no discernment of that at this point. But, and then just, healthy, real, fresh foods when the child starts, on a solid diet is so important. And there's so much commercial pressure, there's so much peer pressure, there's so much, to manage with trying to get kids to eat good foods. It is hard, but it's not impossible. I mean, you look at kids in other countries, even in Europe, even in Western Europe, I mean, they do not eat like American kids.
Right. My
They're not
family's
given the
still
option. It's just not an option. They
exactly.
eat real food,
Yeah.
But
My family's still doing an intervention on me for the things I was like, no, he can't have that. He's a 2. He doesn't need to have,
right.
that junk.
But they're just bathed, and that's being the normal.
Yeah.
It's really, really hard, but that stuff does, does do damage. But keeping the, child as healthy as possible and not having these constant exposures to things that are making them have an allergy response or a sensitivity response, because that by definition is creating a distuned, dysfunctional immune system.
Yeah.
Then what happens when they confront a pathogen, which they invariably will, whether it's a ubiquitous virus that we all get exposed to, like, Epstein-Barr or cytomegalovirus or HSV or whatever it is,
Right.
or Lyme or a co-infection or something like that, the scenario will play out very differently if they have a balanced immune system and they're very healthy than if they're not. And genes play a role, but you can't change the gene. So it's
right.
It is. So.
And as you talked about C-section and breastfeeding and all of that, it reminded me of a lecture we were both at with Yehuda Schoenfeld through Designs for Health and Cassie that you had organized. And Yehuda was standing up there talking about being responsible for his daughter's perineal picnic. And for our listeners or viewers that don't know what that is, when you have a C-section, if you take a swath of the mom's vaginal mucosa and rub it all over the baby, you are in some ways reproducing what they might get from a vaginal delivery. And he was so wrapped up in emotion, he said he forgot, and he showed a picture of his dog Lolly, licking all over the baby afterwards. And, pets and being outdoors and dirt and all of these things all go into that microbiome of our bodies.
Yeah, that's a great point. There's actually multiple really good studies that kids that grow up in households with pets, dogs or cats even, there's more on dogs actually, healthier immune system have less autoimmune disease. We know that children who have grown up, even in this modern industrial age, the kids that grow up on more rural farm environments, that they're exposed to farm animals and manure and all this stuff, have much less atopic disease. They have less,
Yeah.
skin issues and reactive airway and asthma and all that kind of stuff. There's one exception to people who grow up on farms with autoimmune disease, and it's actually with Crohn's. They have more Crohn's, and it turns out that the some of the bacterial organisms that can create that granuloma like degradation of the middle of the GI barrier,
Yeah.
which is a hallmark of Crohn's, when you do the biopsies and look on imaging, almost like TB, where you get those granulating, caseating kind of, you can't get
Yeah.
antibiotics to
Yeah.
them, right? Because they're walled off. And then, if you open them up, it's like, cottage cheese in there. It's disgusting. It's like a big abscess. The bacteria that can cause some of the diseases in cattle, it's, what is it again? Yeah, I'm blanking on the organism, but
I know, me too.
yeah, that organism they can get exposed to from cattle, and if they're genetically susceptible, it can create Crohn's,
Interesting. I
which is
never
really
knew that.
so
I
just,
always learn something new from you, David.
yeah,
It's great. And one of the things in kids with PANS pandas is you mentioned your boys, one in particular being so tough with diet, so
yeah,
many of these kids with that particular autoimmune disease also get restrictive eating disorders. So
yeah,
the actual disease
yeah,
increases their
yeah.
ARFID or their
Yes, to
reactivity.
feed forward, kind of positively manifesting it. Yeah.
Yeah.
But my other boy, was like 20 months younger, was much better eater and ate a much wider palette of better foods. But they both got Lyme and co-infections,
Yeah.
and they both got some variant of PANS, right? They presented a little differently. One more persistent kind of fatigue and flushing and that kind of thing, and the other more neurological, with the tics and
Yeah.
the even for a while there was one point you probably remember, I don't know, but he couldn't go down the stairs. He was going
Oh,
down
I
the stairs on
remember.
his butt. He couldn't use his light, like intermittent, like out of nowhere, and then everything would kind of normalize. So luckily they've done so great, and I thank you for that, because I think it was certainly your care that made that possible. But they're thriving, young adults, young men at this point, but it was a tough one.
Yeah, it takes a village. I mean, and you guys were such a part of that village, and it's just these kids can get better even when we can't do all the wonderful diet things we want or every supplement, herb, medication, whatever. You raise them in a very supportive environment that then allowed them to flourish when their bodies could heal from the
Yeah.
autoimmune disease. So,
And it's
you know,
amazing, even when you lose those battles with kids on diet and all that kind of stuff because of all the external pressures or because of their food issues or whatever,
yeah,
it's still all the lessons and the effort and the attempts pay off because it comes around. So even our older one, who was the picky eater and all, he still, has some issues with really expanding his food palette, but man, it's so much better. And he's literally making concerted efforts and trying. I mean, he knows the message was sent, and it got through that you got to eat healthy to be healthy, and he wants to be a commercial pilot and all that stuff, so he needs to be healthy. He needs to pass medicals and all that kind of stuff. So he's working out, he's eating good, he's paying attention, he's not having not eating that bad food choice. So it's kind of fun to see that that
yeah,
it comes
yeah.
around.
Exactly. It comes around, and not forcing the kids, not making it such a battle, but showing them, and still saying, hey, this is a way to get healthier, and I'm going to do it, your mom's going to do it, modeling that can also be helpful. And even if they go through a long period in childhood where you can't make the changes that you would like to, they often come around to it later, as your guys do. So
Yeah. Yeah. And I think it's even more once they get a little older, I think it
exactly.
definitely makes a difference in the whole psyche about all of that in actual adulthood when they get there. That effort, like if they had parents that paid attention to that and planted those seeds. But also you can't be so fanatical about it that it's penal. Like we're not
Exactly.
perfect either. They see us really trying to eat really well and be healthy and do all the right things. But hey, we have our moments and our splurges, and we're not perfect.
Yeah,
But
well,
but when we're
and
not, we don't just say, "Oh, it's over now." I get back on a horse the next day. You know what I mean?
right, but I always talk about being perfectly imperfect,
Yeah,
because the perfectionism in it is also damning, meaning
yeah,
the stress that it comes from trying to be perfect yourself, or your kids to eat perfectly or whatever, decreases your glutathione, increases your fight or flight, your stress,
right.
etc., and is no better than being as good as
Yeah,
love our
because
diets to be.
like you were talking about with these problems themselves can create the food issues. Well, they certainly, we know, create anxiety. They create
Right,
hypervigilance, like a sky is falling, like, a kind of scenario in your central nervous system unconsciously, right?
right,
So it just creates that bias. You get microglial inflammation and you get a lot of changes in the central nervous system. And you don't need to add to that anxiety and stress and you know
right,
neuroticism almost. That's a baked in element when the immune system is just hijacked and gets overactive.
right. Whatever it is, it's always important to ask, how important is it? That he takes this pill in this moment, or he eats this piece of broccoli. Let's look at the big picture of the stress of all of this too. And I think that's
Yeah.
important.
That's hard
Um,
to frame when you're young. I
yeah,
mean, listen, I'm just getting to the point, now, of where I'm framing things different. Now when people ask me, like, oh, how are things going? I haven't seen someone, like, I haven't seen you in a while. How are things going? Usually my response is all the important stuff is good
yeah,
because that's all
yeah,
that matters. You know what I mean?
right,
The other stuff is just doesn't matter, or it's a temporary annoyance, but it used to be sort of this crisis that you had to get anxious about or solve
right,
immediately. And there
right.
there is wisdom with age, but we're dealing a lot, especially in your case, with patients who don't have that perspective yet.
Right, right. But just an extra breath, an extra moment of, this too will pass, or we can do this, can help
Yeah,
even in those moments. So,
yeah, for sure.
all
Yeah,
right, back to, without philosophizing too much, back to autoimmune disorders. When you're looking at somebody with an autoimmune disorder, a child or an adult, what kind of testing, screening
yeah,
do you do to find the disease, or those are at risk?
yeah. I mean, admittedly, I treat mainly adults, right? But I think all of what I'm about to say is pretty much crosses over, is conserved over no matter what age you are. There's specific challenges in dealing with younger people and children that you're great at, and gave me shared some of those hacks or tricks over the years when I do have younger patients. But what's, I think, kind of cool and liberating about the functional integrative medicine model when it comes to autoimmune disease is it almost doesn't matter which one you have.
Yep.
I
Yep.
know that there are uniquenesses, in HLA patterns and immune predilections, or even trigger things or microbiome aberrations in specific autoimmune diseases like MS versus lupus versus rheumatoid arthritis versus, ulcerative colitis versus PANS versus whatever. but there's way, way more in common than there is unique, right?
So
So
true.
you need to climb in functional medicine. By definition, we try to climb upstream as possible to get to the foundational root of where things start going wrong whenever
Yeah.
possible. It's not that we're never dealing with the ultimate symptoms and trying to make people feel better, but that's almost the exclusive, that's almost where conventional medicine has just become a management of the ultimate expression of the disorder with an agent, right?
Right.
So manage
Name
the
it, blame
symptoms
it,
and
tame
act
it
as
medicine. Yeah.
and part of that is actually, unfortunately, by intention. I think, decades ago, I think modern Western pharma decided we're not in the game of curing things anymore. We're in the game of managing things because that's where the money is, right? I hate to be
Yeah.
that cynical, but if you can have a large population that's still alive, so they're technically still potential customers, but they're miserable and chronically ill, and they need a whole bunch of things every month to make them feel like they can get through the day, well, then you got a wonderful business model because it's almost like selling the inkjet printer that cost you, 150 bucks to make for 20 bucks because you're going to be selling them way overpriced inkjet cartridges forever, right?
Forever.
So,
Yep.
so in functional medicine, we try not to follow that uh, kind of logic, although it happens. There's a lot of green substitutions for medicines. I'll use this herb instead of that drug, or I'll use this nutraceutical instead of that, or this. And sometimes we do that just because it can be helpful. It can help the patient's existence and their quality of life. But you can't only do that, right? You got to try to
Right.
keep, whenever possible, some things it's not possible. You got to seek on trying to go upstream and getting to the heart of the matter, if you will. And
Yeah.
that's what we do in autoimmune disorders. So we need to find out where are those tipping points. We know we can't change their genes. We can use the genes though to test to find out either diagnostically or what their predilections are, even in a proactive way. So you
Right.
could look at, autoantibodies and HLA antigens and all that and go, well, this person, I know it all lines up that they're going to be much more susceptible to rheumatoid arthritis, let's say, unless they clean up their act, or unless they get their gut cleaned up, or unless they, clean up their diet or what have you. And you can do that across, most autoimmune diseases. There's actual, tremendously accurate actuarial data. If you line up with certain autoantibody profiles and HLA patterns and things like that, we know that if you live a typical Western existence, diet, and lifestyle, that within, let's say, 8 years, 8 to 10 years, you're at an 83% chance of having rheumatoid arthritis. That's how bad it
Absolutely.
is, right? Not that those kind of tests are being broadly used in clinical conventional medicine, because they're not. They would be in the realm of rheumatology, but I don't see them being used in that manner very much. Some of those are used to confirm a diagnosis that they think is there from clinically, from the presentation of the patient, but I don't see proactive screening like
Yeah.
done like that, saying, hey, you got it in your family history. When we do these tests, you're going to get it too, unless you do XYZ. That's
Right.
true
I don't see
preventative
that in
medicine. They don't
conventional
do that.
medicine.
They don't do
Right.
it, right? So in functional medicine, not all functional medicine doctors do it, but a lot of us do, right? Particularly if the patient is willing to go through that testing and is willing to make changes. But I think consistent with the whole paradigm of functional medicine, we really put a lot of importance on the gut and the health of the gut. That you can't really be healthy fundamentally with a gut that's not healthy, with a microbiome in the gut that's not healthy, because the dominoes start to fall immunologically often in the gut. Not
Right.
exclusively. There's autoimmune diseases that are very driven by viral exposure, let's say, that
Right.
don't necessarily, it's not like the main dominoes start to fall in the gut. But there's no question that we have more exposure to potentially antigenic, meaning can trigger the immune system, substances in our gut than anywhere else, because there's as many, at least, bacteria and microbes of various types, phages, protozoa, helminths, viruses, bacteria, you name it, all through our gut that we're having to deal with and come up with a kind of an agreement with. Well, we'll tolerate you being there because maybe you're not going to kill me and you might do a few things for me, like produce some nutrients or help me digest my food or whatever. But then, so you have to tolerate some things because you can't react to everything. But you also then have to be in a position to act if there's an overt pathogen that can really, threaten your existence,
Right.
get an overt pathogenic infection with Clostridia difficile or Salmonella or something like that, you got to be able to react to it immunologically. But it's finding and maintaining that balance of tolerance and aggressiveness when you need to, and then having the discrimination to know, self from non-self. And that's
Right.
when things really start breaking down. So if the gut is constantly this frenetic area of immune amplification, because the microbiome is not in good shape, that you have a lot of the bad or opportunistic bugs there that we know are associated with distuning the immune response and creating actual autoimmune phenomena. And there's a bunch of mechanisms by which that can happen. I won't get into the boring part of those, but we have molecular mimicry, and where, a bug can have a protein on it that looks a lot like a protein on your own tissue, and that can cause a crossover. Particularly,
Yep.
there's also leaky gut. Again, problems in the gut with hyperpermeability.
Yep. And leaky blood-brain barrier. And,
Yeah.
same.
And then, a lot of microbes in the gut produce enzymes that can modify proteins, or they change an amino acid on a protein, and
Right.
they do it because the microbe needs that as part of their physiology. But then if the microbe community overgrows that produces that enzyme, they secrete it, or when they break open, they release it. We can get that systemically, and that can alter our own host peptides. So
Right.
a lot of microbes in the gut, opportunistic ones associated with autoimmunity, can produce an enzyme called PAD4, which can actually citrullinate host peptides. So it will take on certain proteins, if you got, let's say, an arginine hanging out there, it can pull that off and put a citrulline in its place. It's called
Right.
citrullination or citrulination. I can never say that. And when it does that, it slightly changes your own protein. And when that happens, your immune system now looks at that protein that's part of you.
Right.
Now it says,
And now it's foreign.
that's foreign. I'm going to attack that. So that's used in conventional clinical medicine all the time. So doctors, when someone comes in and say, "Oh, my joints are hurting," they're middle age, or they think they might have rheumatoid arthritis, they do a rheumatoid panel, might have rheumatoid factor on it, and C-reactive protein, and sed rates, and all that. But it also usually has a test called CCP or ACCP, anti-cyclic citrulinated peptide. They're looking for this phenomenon of citrullination, but all they learned in medical school is, hey, do this test. And if it's positive, it supports your clinical hunch that they
Right.
have rheumatoid arthritis. But if you ask them, why do you actually do that test? Why are you looking for a citrulinating, product of your host? They have no idea, right?
Right.
So it's because of this connection to microbes that are producing this. And they find citrulinated host peptides, which once you change your own protein, it's called a hapten, right? They
Right.
find these citrulinated haptens in atherosclerotic lesions. They find them all through the brain in dementia and
Yep.
Alzheimer's. They find them in autoimmune disease all over the place. They find them in the endothelial lining in, vessel disorders. So it's a real issue. So we test the gut a lot. We're looking at the composition of what microbes are there, right? Are there enough good ones? Are there no overt, really bad actors? And then
Right.
most of them are neither the overt good ones or the bad ones. Most of them are some shade of gray in between that,
Right.
given the opportunity, they can overgrow and create these enzymes or do molecular mimicry and do some damage. Those are called opportunistic organisms, and we scout out, we screen for them. And if we
Yep.
find them, we're trying to nudge the microbiome composition back to a better composition. And that could be with dietary changes. It could be with prebiotics, probiotics. It could be in some circumstances with a substance that'll get rid of the bad organisms. That can be everything from a botanical to a little oil to a prescription antibiotic.
Right.
Depends on what bug, how bad it is, what's going on. I strongly favor using standardized botanical volatile oil combos with probiotic, prebiotic afterward, rather than even locally acting prescription antibiotics, is you do too much collateral damage.
Right. So
You
agree.
can do too much collateral damage with the natural agents. So you don't use those willy-nilly. I don't like You see a lot of hammer and nail practitioners, unfortunately, even in functional integrated medicine. Everyone has
Right.
sebum, everyone has this, everyone has that,
Right.
and everyone's put on these antimicrobials. I don't think that's a good thing at all.
I agree. And also going back to that U-shaped curve you were talking about, when we push that to the nth degree, we're going to swing the pendulum the other way and make other things worse.
Well, it's like, and I'm going to give you all these biofilm busters, right? And I'm not saying they're never useful and they're never appropriate, but why would you do that for? Keep in mind when you're breaking biofilms like in the gut, it's not only the bad organisms that live in the biofilm; it's the good ones
Right.
too. Like
Right.
burning down LA to get rid of some criminals.
Right.
You're taking out a lot of good stuff too. So you got to be very strategic when you do that kind of stuff, and there's a place for it, but it's not like everyone needs this. And
Right.
that's what you see out there in the wild west of the internet. I mean, on social, you see all this stuff on social media. I mean, people are all of a sudden gastroenterologists or endocrinologists because they had a problem
Right.
and they did
Right.
some things that got better. I'm thankful they did, and I'm sure they're well intentioned, but it's more nuanced than what you see out there.
Exactly. And it's not about this thing is going to help everybody with this
Right.
disease, even
Right.
everybody as an individual.
Right. So back to the question, though, we do look
Yeah.
at the gut pretty intensely, not only the microbes and the composition, but are you digesting? Are you absorbing?
Right.
Do you have enough immunoglobulin production on the gut lining for the enteric nervous system, like IgA? Are you producing IgAs to the wrong things like gluten or gliadin? Do you have what's called leaky gut? Are you inflamed in the gut lining? So you kind of clean up that whole house, right?
Right.
Got to improve their diet if they're eating crappy. But honestly, a lot of people that come to doctors like us are already making good dietary changes. You just need to dial it in a little bit, or maybe test and find which foods that may be considered generically healthy for them don't work because their immune system reacts to it. So we
Correct.
have some testing that's not conventional food allergy testing. We're not looking for IgEs like to strawberries and shrimps and peanuts, and that stuff's pretty no brainer, right?
Right.
But there's some testing that we can look at how the body's immune cells react to specific foods.
Right.
Does it degranulate the cells? Does it create a innate immune response, which is an inflammatory response? And some people can have those negative reactions like that to foods that would be considered generally healthy.
Right. Right. And at the same time, using those tests when there's a plethora of them, what I don't want parents to do is to say, oh my gosh, he's allergic to 30 foods. Let me remove those all. Often that plethora of sensitivities, not allergy, but
Yeah.
sensitivity is from the gut and from a
Exactly.
leaky
That's why I
gut.
don't even do those tests straight away. I tell
Right.
people, listen, we're
Me
going
too.
to circle back around to immune food reactivity testing, depending on how this rolls out. But I'm not doing that right away. I'm fixing your gut first, because if I fix your gut, a lot of that fixes itself.
Exactly. And that's what we find.
Yeah,
Absolutely.
exactly. So that's just common sense, right? But
Yeah.
common sense is not so common sometimes. Uh,
Right.
but but the other thing is trying to, and this is where you said it takes a village. This is where I need colleagues to help me with it. But trying to deal with issues of hypervigilance, anxiety, panic,
Yeah.
that kind of neurological dungeon of dysfunction that
Yeah.
chronic inflammatory immune dysregulatory disorders sends you into, right?
Right. And that
That's
fight or
hard to climb
flight.
through. Yeah, it's hard to
Yeah.
climb. And
Yeah.
if you're always like waiting for the next shoe to drop in hypervigilance, that in and of itself takes a lot of energy, and it's
Yeah.
hard to recover. And when you're like that, you don't sleep well, and you don't go into regenerative stage 3 and 4 delta wave sleep. So you never regenerate. Even if you sleep, you wake up unrefreshed, like you get in classic fibromyalgia and chronic fatigue and long haul. They can say, like in fibromyalgia, patients have told me a million times, I'll sleep 14 hours, but I get up and I feel like I never went to bed. I never
Yeah.
slept. you know?
They're not getting that restorative sleep.
It's not the time sleep, it's the quality and the cycles of sleep that's
Right.
getting disrupted by this hypervigilant effect. So there's a lot of things you can do with brain retraining that you can do with more in the realm of somatic work and like it's sort of variants of psychological approaches, whether it's mindfulness, mind body stuff, and there's a million techniques and ways to do it, and not one works for everybody. You got to find the one that works for that person. uh,
Right.
that's harder in children, I think, just inherently, because
Right. Right. And it is. And I talk to parents all the time about using techniques, just simple breathing techniques,
yeah,
simple yoga techniques that kids can do. And also, there are now like literally vibrators that
yep,
that improve vagal nerve stimulation that you
yeah.
can do with little kids to almost mimic what you're trying to do with the lifestyle changes that they may not be able to access at
Yeah,
their
we use
age.
little vagal nerve stimulators all the time, those gamma, and there's other ones. I mean, there's a lot of different options out there. And there's even lower tech ways to do vagal nerve therapy, and
Yeah.
but yeah, all that stuff makes a big difference. And because some of those things, especially when you get to mind body stuff and even breathing and stuff like that, it doesn't seem like it would make a big difference. But when you do it as a ritual kind of practice over time,
Yeah.
it makes a major difference.
Yeah.
It really
A
does.
simple thing for me, like ending every shower with a cold shower,
Yeah.
has, I can't do a cold plunge every day, but that simple thing has been a reset that makes a difference.
Yeah, I know. That's the one I hate the most, Nancy, though.
I know it's not fun in 20-degree weather, but
No, no.
anyway.
I was
Anyway,
lecturing over in Copenhagen in November, and it was funny. They had all the public, like in the rivers through, Copenhagen. They had all the stands where people would just dive in, plunge, and then
yeah,
take off their, down to their bathing suit and plunge and then get in and, put their clothes back on in these little huts and then go to work, like it
yeah,
was part of their normal, even in like the nightclubs, like the bars and the restaurants, they had little huts and they'd all get together in a group and they do, and they all plunge in the river and then they come back out. It's crazy.
yeah. And the same thing for the kids, they're not
Yeah.
out inside
Oh
in the
yeah.
wintertime. They are out
Oh yeah.
all the time. And that's something we need to work
Yeah.
on here.
Sure.
But you and I agree on diet, on sleep, on lifestyle, on all of these other things. But a couple interventions I think we also agree on, just nutraceutically, curcumin, vitamin D, fish oil. Are there any others that are in your top 3, 5 that
Yeah, in autoimmune disease, and you can see this running through many of my formulations with Designs for Health in the nutraceutical realm, which is I use glycomics a lot. So I'm using different types of sugars, basically mucopolysaccharides and GAGs and things like that to block immune amplification because we know they work very well at doing that. One in particular is N-acetyl D-glucosamine, or what we call NAG. And you'll see
Yep,
that in a couple of products I've, designed many, many years ago for gut healing and barrier integrity, and even newer ones as well for autoimmune disorders, because these are things that they're not unhealthy sugars. Not like I'm giving like, candy here. This is a specific mucopolysaccharide formulation that will actually get in the gears between, it's a little technical, but when you have an antigen, it could be, a foreign peptide from a food or a bacteria or whatever, and the immune antigen presenting cell grabs it, particularly if you have an immune system with the right presenting antigens like HLA antigens that make a big fuss about whatever the substance is, and
yeah,
it presents it to a prime T cell, it has to dock. It's like a lock and key, right? It's a structural thing. And these mucopolysaccharides, when you take them in the gut, they actually coat those gears, if you will, and they
right,
form almost like a glycolytic, like sugar lattice on them.
yep,
And it means when the antigen gets presented to that prime T cell, it bounces off. It's almost like putting chewing gum in the lock. You can't get the key in to pop the lock, and popping the lock is what makes the immune system amplify, right?
right,
So it's a really cool trick, and the body uses that biologically. We figured this out through, normal physiology, but it's just harnessing it in a medicinal way. And, naturopathic and botanical medicine has done this for probably, centuries, if not millennia, without knowing that they were doing that. So when you look at all these traditional or traditionally used herbs in naturopathic medicine for sour stomach, they call it, or for upset stomach or gastrointestinal problems, they were often these herbs that they would refer to as mucilaginous herbs because they had a lot of mucin in them, which is mucopolysaccharide. It's these glycomic agents. And these are the slippery, slimy things. So like if you ever cooked okra, it's got that like snotty kind of stuff. That's the gold, right? So okra, cat's claw, which is used in lime and all those things, right? Slippery elm. It even has slippery in the name, right? So there's all these great botanicals that can do that. Or you can use in more of a nutraceutical, the actual gag, which is N-acetyl-D-glucosamine. So that I mentioned that one. All the ones you mentioned are great, but that's just a novel one that not as many people use in autoimmune applications. Kind of keep people on some level of that, even prophylactically long term if they have ever had autoimmunity. And even in some patients, if they don't have an autoimmune disease, but it's strong in their family and they have all the predictive markers, we can really clean up their gut, keep them with a good barrier integrity, good gut lining, no leaky gut, on a really good diet, get them off foods that we know are particularly antigenic, like gluten and or maybe dairy, depends. And we just keep them on a background level of these mucopolysaccharides.
That's great. That's great. Another good tip.
Yeah.
Well, David, I could talk to you for hours and hours and listen and learn, but I wanted to leave with one of two things. I often ask, is there anything else you want to leave our listeners, our viewers with? But on a podcast you did, I heard somebody ask you, what is it that you have changed your mind about? So either leave them with a pearl or leave them with what you've changed your mind about. What would you say to either of those questions, or both?
Could I say the same thing as I said? Maybe?
Yeah, absolutely.
I think I know what you're talking about, because that would kind of put me on the spot. But I've changed my mind. Part of it goes to this different perspective as you get a little older.
Yeah.
I've changed my mind about being right so much. I'm totally okay with being wrong about something and changing my mind.
Yeah.
Much more.
I love that. You said that before.
Cling to I'm right. I guess it's a young ego kind of driven thing. But sometimes we just have to rethink it all. And I think in one podcast I gave this example. I've had really difficult patients. I get patients coming from other functional medicine doctors, like you do. Yeah. So I don't get easy stuff. I get stuff that's really hard, or it would have been taken care of. All the low-hanging fruit has been picked, right? And the immune test and supplements, all that. So I've had patients where I've just gotten in that scenario, and they've been a patient of mine for a while. We've been working with them. I'm frustrated. They're frustrated because they're not getting the right kind of outcome that I would have hoped for, and I usually get. I've gone in and introduced myself as, hi, I'm Dr. Jones. What's your name? And, and they'll go, well, what do you mean, what's my name? You know me, I'm there. I'm like, no, you're not married today. Pick another name. And you're Dr. Brady. No, I'm Dr. Jones. Dr. Brady has no idea what's wrong with you, clearly. So we're going to start again, as Dr. Jones and whoever, because we need to just rethink this.
Yeah. A mentor of mine once said, you always have to go through the door, not the window.
Right.
And you may have to rethink it. And Sid's mentor always said to him, Dr. Sidney Baker, have we done enough for this child? And that's, we're not always right. We don't have all the answers, as long as we keep looking.
Yeah. And I don't mind telling people I don't have all the answers. Not some magic, poobah that cures things. We're just, we're kind of coaching you through and trying to help it out and uncover it. These are complex things. We're not dealing with a simple, this for that kind of medical scenario. These are complex, multifactorial, chronic metabolic issues that are not easily solved, or, we wouldn't be doing what we're doing.
Yeah. Well, David, it's been a pleasure. Thank you for all your words of wisdom and for all you do in the medical community and the research and nutraceutical and lab communities, and just for your posts on all the fun stuff you do too.
Thank you. Thanks. I'll get back to having fun, Nancy.
All right.
Although this was fun. This was fun too.
Well, thank you. Good to see you. That's it for today's episode of Demystifying PANS, PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS, PANDAS.